Welcome back, everybody, to Dr. Sellers Educate. We're happy that you're with us and excited to share another episode with you. We will be focusing on our study workbook. If you haven't purchased it, we highly encourage you to do so. If not, we still have the information that we want to share with you to help you be successful on the CNE exam. A couple of reminders. First of all, we are excited to share that we have had 5 more nurse educators pass the CNE exam, and we're continuing to support several more as they are on their journey within the next 30 to 60 days to sit for the CNE exam. The content for today will also cover the CNE novice exam and the CNE clinical exam because evaluation methods are included in all 3 CNE exams. Okay, so we want to make sure that you're prepared no matter which path you choose to get certified as a nurse educator. So second reminder is that you want to invest the time to study. Okay, as great as the content is here that you're reviewing that aligns with the NLN standards and recommended references, although we're not endorsed by NLN, we strongly support their mission and we are dedicated to every single nurse educator being successful on the CNE exam. So we're here to support you on your journey, no matter where you are in the process. This is a no judgment zone. All right, and then our final reminder is to sign up today for the August 13th retake session. Okay, you don't want to miss it. We'll be excited to share information to help you be successful on your journey if you're retaking the exam. And if you're taking for the exam for the first time, it's very relevant information for you too as well. We will have one of our recently successful nurse educators that did have to retake the exam. She has agreed to join us, so we're very excited for you all to hear directly from her. All right, so those are our reminders as we jump into our content for this episode. So when you pull out your workbook, if you have it in front of you, there's a couple of elements that we want to make sure you focus on, remembering that the purpose of the workbook, which was designed by Dr. Sellers Educate, was really in response to some of the feedback that we received from many nurse educators. Okay, we heard loud and clear that Dr. Caputi's resource is excellent. Billings and Halstead Teaching and Nursing 6th edition is excellent, but there's a little piece missing. The purpose of this workbook really is to maximize your time. Okay, we know that you have limited time. Taking the CNE is an investment. Okay, it's a financial investment, a huge financial investment, but it's worth it, right? And it's also an investment of your time and your energy. Our time is limited, so we wanted to maximize, provide you with the resource to maximize your time. All right, so that's the purpose of the resource. So when you take a look at the study plan, it's designed in 7 weeks. We have seen 100% success rate with nurse educators who follow our study plan as it relates to getting ready for the CNE exam. And that's for all 3 exams, even though here, the example we're sharing today is from our CNE study workbook, which has 8 competencies. So if you're studying for the CNE-CL, you have 6 competencies. So you can modify this, based on where you are on your journey. And then the CNE novice also has 8 competencies. All right, so as we take a look at the workbook and your study plan, there are a couple of components that we want to highlight for you as it relates to part 3. So we're looking at evaluation. If you have your Billings and Halstead resource in front of you, we want to refer you to a couple of really good parts in the resource book to help you close your knowledge gaps. First of all, when you look at nursing program standards, you want to look at CCNE, even if you're not a CCNE facility, because they are one of the highly reputable professional organizations, regulatory organization, actually, I should say, that really sets the standards and follow those based on the elements that are listed in table 27.1. Okay, so if you are not familiar with all of the CCNE standards, I highly encourage you to take a look at those. That's going to start on page 518 and it continues through page 524. And then the second part, when we talk about nursing program standards, is going to be the program evaluation. Okay, and that starts in chapter 27 as well, and it's page 517. All right, so if you're not familiar with the program standards, CCNE standards, we highly encourage you to take a look at those. Could you be asked specific questions about CCNE standards? Well, you could, although the blueprint doesn't spell out a specific organization as far as accreditation, but again, it is a very popular accreditation, so you want to take a look at that one. Now, you want to familiarize yourself with all of the actual organizations that accredit nursing programs, and that's going to be in your Caputi reference. All right, so what else do you need to know about program standards? I think that's a good start, but if you have questions, you can always reach out to us at info@drsellerseducate.com. And we want to pause right here and say, if you haven't subscribed to this channel, go ahead and do that right now, because every single week we release a new episode. If you're listening to us through our podcast, we welcome you as well. Or if you're tuning in on our YouTube channel, that's where you're going to be able to subscribe. And then on our podcast channel, if you just stay tuned every week, you'll see new content added, or hear new content added, I should say. We know that you're super busy, and that's why we added our podcast, so you can truly listen on the go. All right, so evaluation strategies as we wrap up, and assessment instruments, those kind of go hand in hand. You're going to take a look at table 24.1. We really like this table in Billings and Halstead because it gives you a summary of evaluation strategies, as well as the domain associated with each of those evaluation strategies, the assessment purpose, as well as possible applications. Remembering that the CNE exam is all about application, right? Just like with the NCLEX exam, as we prepare our pre-licensure students to sit for that exam, we talk to them a lot about application. And that's important because the content has to make sense for you. All right, so no matter where you are, we highly recommend 3+ years of experience. Those are the nurse educators that have the most success the first time, those that follow our study plan, those that have 3+ years of experience, and those that have some type of group coaching or mentoring. Okay, now we offer that here at Dr. Sellers Educate, but if you have a nursing colleague that has been successful on the CNE exam, we highly encourage you to use them as a mentor as well. Okay, but again, we offer that service if you need it, because we want you to be successful. All right, so when you look at, let's just take a look at table 24.1. One good example is reflection. And if you all have been with us before, you know that that is one of my favorites, is reflection. So you see on table 24.1, it says the domain is high-level cognitive and the affective domain as well. Okay, so both of those domains are tied to the reflection activity. And then the assessment purpose, it can be formative or summative, depending on how you use it. So you could use it for trending purposes if you used it as a summative evaluation tool. And then possible applications could be a self-assessment, integration of learning, as well as appropriate for assessing the higher level cognitive skills, critical thinking. All right, and one good example, of course, is the clinical journal. If we ask students to complete that post-conference, then they reflect on their clinical experiences, where they can even learn from each other, especially if it's a discussion forum, but we want to give them feedback as well. In the clinical faculty role, we give them feedback throughout the clinical experience, but we give them formative feedback, that's what that's called, throughout the clinical experience, but also summative feedback through the final clinical evaluation tool. So reflection is also a way to provide that formative assessment if we are giving them feedback and they're journaling throughout their clinical experience. All right, and then our last point as we close out is going to be taking a look at some additional content in our workbook. All right, so let's flip over there if you have that in front of you. If you don't, you can also take advantage of looking at the resources that we're going to be talking about. All right, so just taking a look now, we're going to start on page actually 35, and it starts with the practice question. So let's take a look. So you have a situation where it's asking you in the practice question about which best represents the purpose of a formative clinical evaluation tool. All right, so let's take a look at our choices. So the choices you have here are going to include, let me make that big for you so we all can see it. All right, let's go to share. If you haven't seen Canva yet, this is Canva. We highly encourage you to consider using it because it's just a great option for you to use in the clinical experiences with your students. So clinical or, of course, presentation in an LMS. The clinical experience, of course, if you were doing a pre-conference or a post-conference with an actual presentation, that would be a great way to use it. But if you're not doing it in a presentation format, you can still take advantage of using Canva for the clinical experience as part of an assignment. Okay, it just gives a a nice image for students, and that it's highly engaging as well. So we encourage you to use Canva, and it's free for most faculty too. When you put in your email for your institution, usually they waive the fee. But if you have any problems with Canva, they have excellent customer service as well. We don't have any affiliation with Canva. We just try to provide some resources and recommend that those that we have seen work really well. All right, so I think we're ready to go now. So let's take a look at this practice question, and you can pause the video and read it, and then come back to us when you're ready to take a look at the answer. So if you chose B, you are correct. So students' learning is assessed as they progress with faculty feedback. Option A isn't related to the question, and then option C is a form of summative evaluation, and D is program evaluation. All right. So we hope that that was informative for you as you focus on closing your knowledge gaps. And if you have questions, as always, reach out to us with our through email. And we also have information on our website about various resources we have available. That's going to be drsellers.com, drsellerseducate.com. And until next time, we hope to see you in during our next episode. If you have any questions, we look forward to answering those for you. All right, have a great week, everybody.